Hello, everybody. This is Andrew Cosman, physiotherapist with ADM Ottawa Physiotherapy. Today, I wanted to continue our series on pain science by discussing with you yellow flags. Some of you may have heard the term red flag, which usually is indicative of a serious pathology that needs urgent medical attention. Yellow flags are psychological risk factors that exist that can prolong a person's experience of pain or injury and might delay or prevent return to work. So we'll get in a few examples in a moment, but just to be clear, this is not to be confused with a diagnosable condition or disorder that is related to mental health, such as being diagnosed with a bipolar disorder or a clinical depression of sorts. Those can be relevant in a person's experience of pain, but that is not what we are talking about today. When we talk about yellow flags, the examples that are most commonly found in a physiotherapy practice might be something along the lines of uh, fear avoidance behavior, meaning that a person has an exaggerated avoidance of movement as a result of their pain or injury. They have feelings that the pain cannot be controlled, or expectations and feelings that they will not be able to get better. A misunderstanding between hurt versus harm. Of course, things can hurt but not necessarily be harmful. A common example people share, I've heard going to the dentist, for example, not always a pleasant experience, but at the same time, it is for the health of our teeth. So hurt versus harm, and not confusing the two with each other. Where a person's pain might be eliciting emotional responses such as fear or anxiety. These are all examples of yellow flags. So why are these yellow flags important to begin with? Research has begun to understand better that these characteristics, or the presence of these yellow flags, may be as important, and in some cases more important, than the typical weakness or inflexibility that a person might present with. So to give you an example, if somebody is coming in with pain in their hip, and they also seem to be having some fear avoidance, let's say, along with a weak hip muscle. Well, the old school way of thinking would be to get that muscle stronger in order to help that pain get better. And that is still very relevant, but what the science is telling us is that if that person has a fear avoidance of movement, overcoming that avoidance may be as important, and in some cases more important, than getting that muscle stronger. So these psychological risk factors that we're talking about, or yellow flags, can be very necessary to deal with in terms of having a complete course of physiotherapy. Now, if we try to understand other implications of these yellow flags, a very common question people have when they come to physiotherapy is, how long is it going to take for me to get better? And you can start to see where a person that has some yellow flags versus a person who does not have yellow flags but has the same hip injury, the answer to that question will vary. So understanding the presence of yellow flags and their implications on a person's experience of pain can help a physiotherapist plan better and understand the timelines and prognosis for a particular injury. Now, this information is not to go on and diagnose yourself. It is very normal, for example, for a person who has pain with a particular movement to avoid doing that movement. Does not necessarily constitute a fear avoidance type behavior. So there is a line where that gets crossed where it becomes an exaggerated response, and that is for the healthcare practitioner to determine, and not for yourself. So please take this information as educational, but not necessarily for the purpose of self-diagnosing. As always, if you have any questions, you could always reach out, 613-820-8765, and I'd be happy to answer any questions. Take care until next time, and we will talk to you again soon. Bye for now.